Getting back to school also means getting back on the playground for many kids, and that often leads to accidents, which can leave unsightly scars. Dr. Young Cho of Integrated Plastic Surgery is here to talk about why you might need to consult a plastic surgeon if your child gets hurt, and how old scars can cause problems later in life, but could still be treatable. Thank you for joining us this morning. And we were talking about this sort of off camera, wondering, I guess parents, when you think about scars, you may think of the small cuts and the bruises, but there are times when the plastic surgeon does need to be involved with children.
Absolutely. You have children playing on the playground, they're at school, they could be at home, and they have an injury. And often if it's a small scrape, they'll heal on their own, but if it's something that's deeper or in a cosmetically sensitive area like the face, that's when it's worthwhile seeking a plastic surgeon, and sometimes even just going to the emergency room to look for some deeper injuries, whether it's fractures or injury to the deeper structures.
So parents should definitely keep that in mind. And do you go immediately to the plastic surgeon, or do you go to your family practice doctor first? How do you make it to the plastic surgeon?
Often it's either through the emergency room or going to your family practice first, or if you already have a relationship with a plastic surgeon, then that would be the reason to go straight there.
Okay, so let's talk about older scars, and that is something we talked about off camera too. But when should you consider going when you have an older scar? How do you know when it's time?
So an older scar, by definition, is something that is mature and stable. And if that mature and stable scar is of concern to you, that would be the reason to go seek a plastic surgeon. So for example, we have a lot of childhood scars that heal. They may grow and stretch as the adult body grows and stretches from childhood. And if they are, for whatever reason, unsightly or causing any functional problems, such as pain or limiting the range of motion of certain joints, that would be a good reason to go seek a plastic surgeon, or certainly if it's in a cosmetically sensitive area.
And we're talking children, but obviously this can also relate to adults. But a scar that needs attention from a plastic surgeon could also create an emotional, could have an emotional impact on someone.
Absolutely. So it could be because the injury itself is traumatic, and every time they see the scar, it's a reminder. And if it's disfiguring in any fashion because it's wide, it's raised, or it does have things like pain, or it does limit the range of motion or a functional impact, then absolutely it can have a devastating emotional impact. And
what about if the scar is, let's say it's botched from another cosmetic type procedure? And again, talking, it could be within a child, but also an adult.
I would definitely go seek some additional advice and consultation with a plastic surgeon. Things that affect scarring are multiple. So you can have poor wound healing because of the nutritional status of the patient. It could be because there's a lot of tension on that scar. So they may be doing certain things after revising the scar to limit the amount of tension that incision experiences, whether it's immobilizing a joint, whether it's using some after scar repair therapies such as silicone gel sheets, whether it's some topical medications. We can use lasers. So there's many ways that we can affect the scarring process afterwards. But you also have some people of darker skin tones that may form darker and thicker scars. So we take some extra precautions in those situations as well.
Thank you so much, Doc. It's always great to see you, and always great advice. Thank you so much for joining us.
Thank you.